So our next speaker will be Pranesh BALASUBRAMANIAM, who is going to talk about myths and facts of gamification in medical education. What has evidence demonstrated? Speaking of evidence-based.
Thank you, Dr. Kahl. It's an honor to share the stage with my mentors in ophthalmology and medical education. So this talk is on gamification in medical education, what evidence is saying to us. How many of you play games? Or have played games, should I say. But there is no age bar for games, right? So we're going to see how we can make use of games in teaching our medical students or residents. So we have got these 6 E's. The objectives will be these. We will explain the different terms, very confusing terms used in gamification, and we will learn the game elements which we can employ in our education. We will appreciate the various underlying learning theories with some real-world examples taken from the current evidence. And finally, we will summarize to look at the essentials of gamification in medical education. So I've made like a mind map. If you can scan this QR code, it will go to a mind map, which I am using to present this talk right away. This is an interactive mind map I'm trialing out with my audience in APAO to see if you can open and close the branches by yourself. So you can navigate along the talk as I'm talking through. Deactivated, I'm very sorry about that. I'll share you the activated one later. Great. So gamification. Like I said, it's using the game elements to enhance the learning of our students. The goal is not to entertain them, but rather to educate them. That's why they use the term serious games. And simulation is a close relative of games. Mr. Saleh will be discussing on that as well in the next talk. I see simulation as a form of a game, but some educationists differ in that aspect. Now, a game should have these following elements. Like a movie, the game should have a fictional scene. There should be some rules which has to be employed in that movie to create an immersive experience for our learners. And you will have these protagonists, the heroes, you will have the villains, the challenges. So imagine game like a movie. The journey to attain a common goal should have different levels of difficulty. And the most importantly, there should be immediate feedback, positive as well as negative. So these are the elements of a game. The next video has an audio. I would request the AV to enable the audio, please. How many of you played Mario? It's one of the very few games I've ever played in my life. And it's probably the most popular of all games. And applying the game elements to Mario game. So you have a fictional scene, you have rules there, you have Mario, the protagonist, he has to save the queen. That is the ultimate goal. And he has these different journeys. Audio, please. Nostalgic music, right? So this exactly shows why I suck at playing games. I tried playing this last night, and this was the result. So you can see that Mario is having the rewards. He is facing these enemies or challenges or the villains there. These are all elements of a game. And we want to take all these elements into combining with the existing curriculum or the content what we have. We are creating this game where the audience is going to use that game, which is supposed to modify positively the skills, knowledge, and the attitudes of the student or the learner. So speaking of which, let's move on to the next E, the educational theories underlying gamification. So what evidence is saying is that games are not simply for fun. There is a science behind why we play games and why we use games in teaching. The first is this experiential learning theory, where learners use their experience to build a concrete understanding of a topic, and by feedback, they are trying to solidify or cement their understanding. The deliberate practice theory is not just for games, but for all of us. How we can make use of intentional, mindful practice with regular feedback can improve our habits, can improve our skills. The social comparison theory is a bit controversial. It says that students react either positively or negatively by extrinsic motivation, by comparing themselves with their peers, like the leaderboards, what we have, who's ranked 1, 2, and 3. It can motivate, it can demotivate a student, which we'll discuss later. Some of the examples of games. Can you give me one example of a game which we commonly use, which is right on our phones, which some of you might be using very frequently, checking every day? Any guesses? It's there on this. The fitness trackers, probably the most related game. Always checking how many steps have I walked in this conference. Have I taken the steps or lifts? So this Fitbit Apple Watch gives us an exact application of games. It has rewards, it has streaks. Have you completed this task on day 1, 2, 3, 4? These are all very good models to use in our teaching. When it comes to medical examples of using gamification, I see two broad categories, although it's kind of blurred margins. Quizzing, by giving puzzles to solve, asking questions, that's one part of this gamification. The second broad category is using simulation. Mr. Saleh will be discussing about that in the next talk. The medical examples, like Prajana sir was mentioning the other day, how he uses his DigiNerve learning platform as a flip class and how he uses Kahoot as a useful tool to get the audience response. That is a game. For my students, I simply use the MCQ question bank, what they prepare for their exams. I pull up the questions, I even open up the real time, divide into teams, and I play a game. So game is something which you can use, you can personalize to your needs, to your skill level. It doesn't have to be really, you should have these things, so on and so forth. Jeopardy is another popular game show. Dr. Karl was mentioning the other day about how it's being used by the doctors in his university. My friend uses Jeopardy to teach medical students. It's quite an interesting game to play. I've never played this, I've never used it in my experience, but you can see you have different game boards and the audience can choose what they want to play, and you can see there is an answer and the students have to come up with the question. It's kind of counterintuitive, kind of interesting way to analyze a topic. Speaking of simulation, we'll have the next speaker talking more in detail about the IC simulator, which is going to be like a game. This is, from my personal experience, the IC simulation was like an actual game. I had to repeat the tasks, it gave me a score, there was a progress, there was an ultimate goal, there was a positive and negative feedback in real time. Probably the best example for our actual practice would be to use a surgical simulator. Chatbots. One of our teammates, the esteemed Dr. Eduardo, created a chatbot which is going to create artificial patient simulation experience. And this is a QR code to access that bot. I hope this works, because I just copied from Dr. Karl's slide, which you presented last time, so this should work.
I hope it does.
Yeah. Right. There are many case-based scenarios, case-based games available. Please go through that. The biggest lesson what I learned while preparing for this presentation is how interactive, how imaginative the other specialties are, and how not creative we are. They're so creative, they have used almost everything available. This one U Arcade by nephrologists, it's a fantastic game. But all of them have a fictional scene, they have characters in it. And this Clinical Sense is a wonderful app on App Store, which is again not for ophthalmologists, but made by general medicine and surgeons, which create a very interesting, like a house MD based clinical case scenarios. And Dr. Vipin Das will be talking on the VR, how we can use virtual reality in our teaching as well. So let's talk about the evidence. Some selected evidence, one in medical education and second ophthalmology education, not much in ophthalmology to be honest, and some of the drawbacks what we face in gamification. These are two very nice articles, review articles, which I found online, and they kind of extensively discuss about the gamification. Although the first article does not discuss about the game shows like Jeopardy, and they don't discuss about, they don't take in consideration the simulation aspect of things. In off-the education, limited literature, there is one interesting gamification done by from Pakistan, where students were divided into two groups. They had a Rexus tournament. They used simulation. They have these like tournaments like IPL cricket tournaments. They are like A versus B. A gets eliminated. So the first round, second round, we have a winner at the end of the tournament. Quite interesting, something which we can adapt in our practice, I believe. The escape room is another similar thing to Jeopardy, where the audience, in forms of teams, go to an escape room. The goal is to escape from that room. So don't ask me why they're going to the room. They're going to the room to solve some puzzles, and when they solve the puzzle, they escape the room from the demon or from the problem. This is another interesting way where one of our colleagues from UK used escape rooms as a model to teach undergraduate students in ophthalmology. So we have some evidence, and what are the drawbacks which we can see from the various literature? The literature, what we have, they all have less control groups. They mostly say the students had their games in education, games in learning, they felt better, but there was no control groups to compare, to give a right evidence. And there's a lack of consensus on what is a game. There are many definitions for game. Some say game is not simulation. Some say game can be simulation. So there is a lot of controversies there. And like I said, the most important thing is how competitive you want that game to be. If you're going to be too competitive, which we don't want, the goal is not to win the game, the goal is to learn. So when students and teachers understand what the goal is, then our goal is attained. And as always, extrinsic motivation is what being focused on games. Points, medals, badges, leaderboard. But what's more important is the intrinsic motivation, how students are internally motivated to learn. So to summarize, we've got these essentials. Any game simulation, no matter what element we use to teach, should be based on adult learning principles. They stand the test of time. A game should have a clear goal and objectives. There should be a clear progress, a clear path, with an immediate, clear, positive or negative feedback, with the right balance of difficulty and easiness. Too difficult, they give up. Too easy, they get bored. And with a clear assessment of learning outcomes. Thank you so much for this opportunity. Thank you.